Hi, everyone. Thanks again for joining us for the 9th session of our live virtual series, Beyond the Clinic, Living Well with Melanoma. In each conversation, we'll explore some important topics that we often don't get a chance to talk about in clinic. I'm Dr. Raymond Liu, oncologist and director of the Cancer Survivorship Program at Kaiser Permanente San Francisco. I'm excited to introduce today's topic, which is all about our caregivers, the important people in our lives who support us and help us live meaningful lives. As a reminder for everyone, we want to make sure this is as interactive as possible, so feel free to add to the chat and send us questions, just like the chat we got from Tara. Thank you so much. And we'll try to get them answered. I'm looking forward to addressing your questions and comments in our next 30 minutes together. And so today's special guest is Dr. Jamie Jacobs, assistant professor at Harvard Medical School and director of caregiving research at Mass General Hospital. Welcome, Dr. Jacobs. Thanks so much for being on today's show.
Thank you so much for having me. I'm really looking forward to talking about this topic, near and dear to my heart.
Yeah, I wanted to get started with just acknowledging how much caregivers do for our patients, for the medical system, and just get your sense like how important are caregivers to the medical care for patients.
Caregivers are essential, and when we talk about caregivers, obviously there's providers who are formal, we think of formal caregivers, but then there's the informal caregivers. And I think it's such an underestimate of what people do to call it informal, but it really just means that these are people who are unpaid. They're not, doing anything that their lives don't stop, as we were talking about before, to become caregivers. And they're really essential to making sure that the patient's health is, that every element of their health, their physical health, their mental health, managing side effects, that these things are all taken care of as a supplement to what the medical team obviously is providing, which is front and center, but the caregivers are sort of in the background running point on all of this after the patient's discharged from the hospital, or, often, as we've seen now, so much care is offered in the outpatient setting. Care is really shifting to the outpatient setting, and people are being asked to manage IVs and administer medication, not just orally, and doing things that really we require nurse training to do or physician training to do. And so they're becoming so much more important. And, but unfortunately, because of that, there's quite a bit of burden. And even, though people can really enjoy and gain a lot of satisfaction from being caregivers, that can go hand in hand with also being very overwhelmed by the tasks and by the amount of sheer time and energy that it takes to look after someone else's health in the context of a cancer diagnosis.
Yeah, I think you have mentioned before, they're almost in a way invisible to our medical system because they do so much. But, even in our documentation system or electronic medical records, there isn't a really easy way. We haven't really structured the medical system to really honor all the work that caregivers are doing for patients.
Yeah, this is a big problem in our infrastructure. And we sort of think of caregivers as the invisible patient. They come to the appointments, maybe not as much now with COVID, but especially before, or they're on, video conference for the appointments, whatever it is. And they're there managing everything behind the scenes, but no one really asks, and some people do, right? But for the most part, we're not thinking about how the caregiver is doing, because appropriately so, the focus is on the patient and on treating the cancer. But if we really want to be thinking about the whole patient and how we can take care of the whole patient, we need to be thinking about the family and friends that are supporting that patient. And there really is no way to do that, because in most medical systems, we don't have a medical record number for the caregiver, for the family and friend, which means that we don't have a way to record, to document any care that we provide that person. If we provide them with resources, if we provide them with 30 minutes of psychotherapy, if we spend time with them answering their questions, it all gets documented in the patient's record. And that's really not okay from a HIPAA perspective. And doesn't really secure the privacy of the patient or the family caregiver. And so for that reason, care is either limited or not documented, not billable, not reimbursable. And so it really creates a big gap in how we can provide the care that these people really need. And providing them care directly translates to the well-being of the patient. We have tons of data showing what we think of as the interdependence between patients and caregivers, meaning that if the patient is more distressed, the caregiver is more distressed. If the caregiver is more anxious, the patient is more anxious. And so if you reduce the anxiety and distress for caregivers, being that you give them the support, you give them the education, you provide them the necessary tools, both tangible tools and emotional tools to provide that care for the patient's distress will come down, the patient's anxiety and depression will come down. So we have really good data to show that this would be good to do both for the person who's the caregiver, because we care about caregivers, and for the patient that they're caring for, because their outcomes will be better, both physical and mental health outcomes.
That's so interesting, because I think what you're saying is that there's literally research showing that if we take care of our caregivers, we'll do better too as patients. So there's direct link that feels very intuitive, but it's actually a proven link that we can do better as a community, that the community itself is supporting each other, and it's all the rising tide lifts all boats per se. Yeah.
Exactly. Absolutely. And, even some data coming out that's showing that if we can improve quality of life for caregivers and we can help them get the resources that they need to do the job that they're doing, but also take care of themselves, then that could affect, and we're starting to look into this more because there's not as much data in this area, but actually that could affect healthcare utilization for patients. And, again, this is a sort of burgeoning area of research, and the NIH has started to fund research that specifically looks at, if we improve caregiver outcomes, does that translate into patient healthcare utilization outcomes? And that's a really important area too. So not just emotional well-being is interdependent, but also can we affect healthcare utilization for patients if we're doing a better job taking care of the people around them?
I wanted to sort of, because I've been a caregiver before for someone in my family, my mother who had cancer, and so I've lived it from both ends as a physician, but also as a family member, and I think what you've also talked about too is this sort of like this part of the burden is sort of like the self narrative that a caregiver gives to themselves, like the burden they put on their shoulders, because there's this like I should do this, like what is the responsibility of a caregiver? And maybe you want to talk a little bit about that and how that can affect a person's health and what we can do about it.
Yeah, I mean, I'm not sure how you felt caring for your mother, but there's a sense that people who are in this caregiving role, and I should, back up for a moment. Some people don't like being called caregivers because, you were your mother's son, right? That's who you were first and foremost. And we've had people say, I'm not her caregiver, I'm her husband. And so I should just say, whatever, for people who are listening and tuning in, whatever you call yourself, we use the term caregivers just because we need an umbrella term to be able to do the research we do or to implement policy down the road, hopefully. But when I say like people in the caregiving role, meaning you are doing something, cooking food, preparing, handling transportation, you've picked up all the household chores that there are to do, you're paying bills, you're taking care of your kids maybe too, you're maybe also taking care of your parents or other dependents, and you're taking care of the health of the person, managing medications, multiple appointments, treatments, and side effects, and I'm sure I'm forgetting a whole host of things. But you feel like you should be doing that all the time. And this is what we hear from people in this caregiving role, is that they feel like they can't take that step back to do anything else, that might help them to find some stability. And it's sort of like that cliche, it's not a cliche, but we use it in a cliche way to say, put on your own oxygen mask before you help someone else. Because we really do need to encourage people in the caregiving role to make sure that they are whole so that they can provide the best support possible. And that might mean taking a moment, taking a few minutes a day, making sure that you've eaten, you've showered, you've spent some time focusing on your mental health so that you can provide the care. But people have these, we call them in cognitive behavioral therapy, which is sort of the gold standard evidence-based practice we use alongside several others, mindfulness, acceptance, commitment therapy. But in cognitive behavioral therapy, we call them the shoulds. So it's like a type of distortion that we tell ourselves, I should be here all the time. I shouldn't take time for myself. I should be at the hospital every waking moment of every day during the transplant, let's say, if someone's hospitalized for a few weeks undergoing a stem cell transplant. We've had that. So we try to help caregivers to readjust that distortion and say, I can be here and I can do this thing for myself, or doing this thing for myself is important so that I can be the best caregiver that I can be, and to try to disconnect from some of that guilt, which really just leads to a lot of self-blame and disappointment and resentment, and can really build up over time. If we apply some skills earlier on, then we can maybe be protective and sort of buffer the effects of stress by setting more realistic expectations for ourselves in the long run.
And I think something you've also taught me is that maybe it doesn't take that much time, because like sometimes things seem so hectic, as you mentioned. There's so many things to do for your loved one. It just doesn't feel like there is time to take care of yourself. And I think what you're saying is that, well, it's very important, and maybe it doesn't take that much time. So how much time can we allot to ourselves? Like, is there a magic number? Is there?
That would be easy if there were.
Yeah.
And I'm sure, some people listening are like, I don't have any time. So it's hard, but I think what we try to encourage people to do is just even find 5 or 10 minutes to do something that is good for your emotional health. I think as caregivers, and generally as people who want to maintain control, because cancer is just one of the biggest uncontrollable things in life. And then when we're caregiving for someone with cancer, we have like that added layer of uncontrollability. You can't take the medication as the caregiver. You have to sit back and hope that things, go according to plan. And usually they might not. So for caregiving, what we say, we start to think about how we cope. And you can be a very problem-focused coper, meaning you have a to-do list, you check it off, you make decisions, you take action, or you can be an emotion-focused coper, meaning I say, I can't do anything to control this, so I'm going to step back and maybe do something that's self-soothing. I'm going to go for a walk. I'm going to call a friend. I'm going to do a relaxation, a deep breathing exercise. I'm going to do some yoga. I'm going to take a relaxing bath. I'm going to exercise. I'm going to cook something, oatmeal. Doesn't have to be anything elaborate. Something that you find self-soothing, and that's so different for everyone. But that thing might only take 5 minutes, 10 minutes, 20 minutes. If you start to sort of set an intention and try to build that into your day at a time that really makes sense, maybe the morning is best. You need to wake up a few minutes earlier than the rest of your household. Maybe nighttime is best. Maybe you can catch a few minutes during the middle of the day. But be honest with yourself about when you might be able to integrate that activity, and just try to start really slow baby steps with 5 minutes and see if you can do that repeatedly. Sometimes all we need is that 5 minutes just to do a little reset and help, with our like mood stability. And then you can increase that over time, or you can just keep it at 5 minutes. But you'd be surprised at what just 5 minutes can do.
Yeah, that's amazing, because, I think what you're also saying is there's mindfulness approaches. There's also physical things you could do. And it could be something as simple as, well, I guess you mentioned cooking a meal, if that's what helps, or it could be yoga, or something, which is like a physical activity, or it could be mindfulness, like a breathing activity. So that's more of a mental activity. How do you know, like, when you need it? Like, how do you know when you're burned out? How do you know when you just need a little bit of time? Because are there signs for people to look for?
I think everyone sort of has different signs that they're burnt out, but if you are becoming irritable, if you are starting to be resentful, which are all normal things, right? Resentment is part of any relationship when things start to feel out of balance. And when we assume a role of caregiving, we can start that balance in the relationship shifts a lot. One person becomes the patient, the other becomes the caregiver. And so I don't want people to feel like resentment or irritability is wrong. It can be very appropriate in the moment. But if you notice that becoming your norm, or if, a lot of caregivers talk about weight gain. So that's something that, starts to creep up because they don't have time to cook or make, the more difficult, time-consuming choices to have a more balanced meal. They're eating on the go and for good reasons and not exercising. So that can be a sign for people. Not sleeping, can lead to a lot of daytime fatigue. So any of those can be a sign of burnout. And I always say, it's just like anything else, you want to stay ahead of it. So stay ahead of the crash and burn. You know that when you're entering into this role of caregiving, you're going to just be go, go, go. And eventually that's going to catch up with you. So the earlier you start, the more you can buffer that stress effect, which eventually you will burn out. So you start an activity like that before you need it. And the reason I say just start with 5 minutes or 10 minutes, for a lot of people, I think, they might hear me say 5 minutes of yoga, like that's not, what's that going to do for me? But what happens when what I see for a lot of our caregivers is that they feel like, and this happens for patients too, they might say, I can't do that thing, that activity the way I used to. So why bother at all? Or I'm not going to enjoy going out with friends. So why bother at all? And what happens then is there's like a shutdown and an isolation and a withdrawal from things that they used to find pleasurable. And that further contributes to depressive symptoms, anxiety symptoms, and just overall mood imbalance. So that's why I say just even take that 5 minutes, because the idea, this sort of like fixation on if I can't do it the way I used to do it, there's no point in doing it. Instead, if we try to be creative about the ways that you can continue to engage in things that are important and that you find pleasurable, then over time that will help to buffer the effects of stress and hopefully prevent burnout or minimize burnout.
Right. So I guess what I'm hearing is that, there's a lot of caregiver burden. Our caregivers do so much that it's important to put on our own oxygen mask as caregivers, that it doesn't take that much time. And it's also very individualized on what you could use. We have a question here. What if you've, you like, now we learned here we should be proactive. And I wish I had that this session earlier in my life too, but what happens when you're already there? Like, what happens? You're like, oh, okay, I'm here. How do I pull myself from the brink, and how do I get back to that space again?
Yeah, I think that's sometimes the hardest thing is you're in the ditch and you need to come out. And so take a moment, maybe after this session, 5 minutes, pull out a piece of paper and a pen and write down 3 things you used to like to do. And then think about what are the obstacles, what are the barriers getting in the way of you doing those things. And then try to problem solve some of them. Well, I feel like I don't have any time, or I feel like a lot of people say they feel like they can't leave the person they're caring for alone. And that can be, a really realistic concern. Start to problem solve that. Is there something that I can do in the house that, okay, I'm not going somewhere to do the thing I used to like to do, but can I do that at home somehow? Or is there someone else who can help out and stay at home with the person I'm caring for so that I can go for an hour? How might I be able to do that differently? And then from there, once you've identified the obstacles and maybe some ways you can solve that, make a plan, set a plan for at least one of those 3 things. Say, this week on this day, I'm going to do this thing for this many minutes. And the more tangible, the more specific we are. This is sort of like the SMART goals. We want to be specific, measurable, make a goal that's attainable, that's the A, realistic, and time specific, SMART. And so the more concrete the goal is, the more likely we are to actually do it and achieve it. So set something that's realistic for you, not something that you're going to end up failing at. And plan in advance, what are the things that are going to get in your way? And try to be creative. It doesn't necessarily need to be, maybe you used to, like to do something outside of the house. You used to like to travel to new countries. Well, is there an online tour you could do of that place? Put on your headphones one night for 10 minutes, do an online tour, just take your mind away. Try to be creative with the things you used to like to do and how can you do them differently. And if you just start slow and set those goals every day for 10 minutes, I'll do this, you might find that you work yourself out of some of that burnout.
So what you're saying is just intentionality. The journaling sounds like it's always been like a very powerful technique for some folks, but just setting that intention to do something and making sure you're specific about it. Again, the SMART goal. What about, because the other thing that I think we've talked about before is just using the community, like, don't not feeling isolated by yourself, but like bring others around you. And how do we reach out for help when we need it to people around us? So in other words, caregivers need caregivers, right? So like, how do we get that help? How do we do that?
Yeah, well, and the other thing I would say to that earlier question is also just, recognizing symptoms of depression is important too. Mm-hmm. And what's fascinating is that caregivers, there's been a lot of data that's shown that people in the role of caregiving may be just as depressed or more, and just as anxious or more than their patient counterpart. So even more important that you recognize some of the symptoms of depression. If you're sad, down, or blue for more days than not, more hours of the day than not, for 2 weeks or more, that's a sign, or you're losing interest in things you used to enjoy doing. Those are times where it's probably more important to get professional help, and to, seek out therapy, to seek out a support group, and to, like you're saying, to surround yourselves with family and friends that can help. Just as we sometimes, we see our caregivers start to isolate or withdraw from activities, there's also that withdrawal from people. And sometimes we can feel some disappointment from people who have not stepped up to the plate in the way that we felt they needed to. But other times there are other people that come out of the woodwork and offer a lot of support where we might not have expected it. And so a lot of our work tries to encourage people to think more broadly about who can provide support and what type of support you need. So we think in terms of 3 different types of support. There's the emotional support, providing love, hope, encouragement, warmth, lending an ear. There's practical support, like doing things, running errands, helping clean, do the laundry, taking someone to an appointment. And then there's more informational support, like you would get from your medical team or credible online sources. And so think about what of those areas of support you're lacking, that you feel like you need more. And then think of who might be good at providing that. And have you reached out to people? Have you reached out to neighbors or acquaintances that offered you help and that you said, I'll lean on my closer friends. But maybe now is a good time to circle back. Maybe you have a community that you're part of in the neighborhood, or a religious affiliation that you can lean on for support. And just try to think more broadly outside of your inner circle about who can provide the type of help and what type of help it is that you need. And then also, do you have any sort of unhelpful thoughts around the idea of asking and receiving help? Because a lot of times we feel like, going back to your original question, I should do this myself. I should be able to handle this. I shouldn't have to ask for help. Asking for help makes me weak. And I would challenge anyone who feels like that to really think about why asking for help makes you weak. That means you're resourceful. That means you can delegate. That means that you know how to identify the players around you that can build you up to make you stronger. And so to think about help in a different way.
How do you, thank you so much, Kim Phil, for this question. I want to, so this is a practical question that I've also had to personally deal with too, which is like, if you're physically distant from the person you love and you want to help, how do you do that? How do you caregive remotely? So in this case, Kim Phil, they live in Texas, and their daughter, who's undergoing melanoma treatment, is living in California. And so there's this distance, there's a time zone difference, there's, physical distance. And how do we bridge that? And because that must feel very, very stressful to say, hey, I want to do something, but I feel so, it can feel helpless because you're so far away.
That's such a good question. I think the distance does make it so hard. And like you're saying, time zone, and I think that I would really start with having a conversation to say, what is it that what are the needs? You said it was their daughter?
Yeah, that's going through treatment right now. Yeah, in a different state. Yeah. So,
being really open and honest about what her needs are. Are there financial needs? Are there needs around, maybe she could really use someone to help clean her house or her apartment. And that could be something that, they could chip in for. They're sometimes starting like a meal train, which you can do online and just send it around to everyone who's close by or not close by. Even you can do a meal train where people nowadays, I can send through any sort of like online food delivery, Uber Eats, Grubhub. I could send a meal to you right now if I wanted to.
Oh, you're welcome to do that.
Just let me know your favorite coffee. But so that's another way that people could sign up. All of your family and friends around the world could sign up and know who's delivering a meal to her on which night of the week, and what time. And also I think just being really, really direct, because people are not good at saying what they need, and people are also not good at knowing what other people need. How should we be? We can't mind read. So I think having that really open conversation to say, how can we support you? What can we do tangibly or emotionally? Maybe it's that they want to have like a once a week check-in to talk about how things are going, or watch a movie together online. Like on Netflix or something. I think you can do like joint show watching. So is it emotional support that she needs? Is it tangible, financial? What is the type of support? And then there are ways now, I think, that remotely you can offer that. But I think starting out with conversation.
Yeah, I think that's what that's so powerful, because I think what's hard, it's about communication, right? So because everyone needs something different and we want to help. This goes with other conversations we had about cancer diagnosis and how do you help engage your friends to help you too. And it's about like that direct communication, and there's different forms of help. So understanding that maybe one person's good at the emotional help, another person's good at the like being there physically, but there's different forms of help. And I think that's amazing. We have a great comment here from Jamie saying, hey, I'm in Texas, so I'm looking for parents to help me too. So it's about the way I'm putting that together, it's about community too. It's about finding local communities or helping your loved one find a local community that can support them too, even if you're far away. Like, are there other resources? We when we moved out to California, we found cousins, and okay, that's not directly maybe a parent or a sibling, but we become very close with the cousins. And so there's other types of family too, and there's other types of friends that networks you can build locally. It's amazing. Exactly. I know we only have a couple more minutes left, so I think, what about resources for folks that don't have resources? Are there national resources that people could use? And
so there's a few sites, and I think some of them are listed on the website, but or on your website, but they are, one is cancercare.org, and they have some services for caregivers. They provide some online, and I think it's phone delivered therapy, a few sessions. The American Cancer Society has excellent resources. They have like a series of videos for caregivers support. Some of those have, and also cancer.org has specific, thank you for putting that in the chat, Eric, has like specific blog posts for caregivers and video series that you can watch, and also online support groups. So I think, the thing about support groups is that you should go and check it out. And then the second you're not feeling like it's helpful or you're not feeling better, you can leave. So just remembering that, I think some people hear support groups and feel like a little bit hesitant to go, but especially with the online platforms nowadays, you can just decide what you want to take and what you want to leave from those. And I would also encourage, people who are looking for individual therapy, psychologytoday.org, I think it is, Psychology Today. I'm going to forget the dot phrase, but
we'll get it on the website for sure.
Today, you can find therapists in your area, and you can find therapists according to their degree, their training, what their specialties are. And and what insurances they take. And that's a really good way to identify an individual therapist for yourself. We have, unfortunately, a huge shortage of therapists right now. So you'll probably be on a wait list, but that could at least be a start to get you connected with someone individually for support.
Yeah, and it sounds like, what I also know is that AIM at Melanoma has a Peer Connect program that can help caregivers find support. So that it sounds like there's a lot we have some online resources at Kaiser Permanente as well. So it's I know the time is always too short, and I want to talk more, and just some amazing questions that we've had today. Dr. Jacobs, I'm just so thankful for you coming today, and acknowledging how much our caregivers do for our patients, for our system and us, and that they are important, and how we can honor them, and how we can help them recognize that, hey, we're all humans. We all need our own support networks, and we have to put out the oxygen mask on, and think about the resources that we have to help ourselves and lift our community up together. So I'm so appreciative of your time today. Thank you, thank you, thank you.
Well, I'm appreciative of you having me, and for everyone out there who is listening, and either a patient or a caregiver, everyone is managing their own stress, and it's so important to be able to just take the time for yourself, even if it's a few minutes.
That's great. So come join us next session, everyone, where we'll be interviewing Sarah Reed. She's assistant professor in the Division of Social Work from California State University in Sacramento. And the topic will be fear of cancer recurrence, another important topic. So thank you, everyone, for joining. And thank you so much, Dr. Jacobs. And we'll be seeing everyone soon.